Hey everyone, Dr. James Stirrett here, and we are going to be talking about the 3 hormones that you have to know about in order to lose weight effectively because they can absolutely be preventing your weight loss. Let's jump right into it. So as I said, I'm Dr. James Stirrett. I have a functional medicine practice where I specialize in naturopathic medicine, helping men and women balance their hormones in middle age and just feeling more vibrant, more energetic, more like themselves, get them back to feeling like the way they were in their 20s. But it all comes back down to hormone levels. So a lot of times, this is what happens. I'm going to set the stage. So hopefully you guys can identify with this because I feel like this is most people. Let's break this down. 42 years old, super busy mom, married happily, got a couple of kids at home, you've got work, things are stressful. It's like you struggle to have enough time for yourself. Health is important to you, but it's kind of started to slip. Okay, maybe you've gained 5 pounds, 10 pounds, and it's like, okay, you start to try to do what worked in the past, maybe in your 20s and 30s, where it's like, okay, lock down this specific diet, work out this many times a week, start to do some cardio, start to do some Zumba classes, and the weight comes off. However, now it's not coming off. You find yourself like, hey, my body is different now. Something has changed. Things aren't working the way they were before. Often, what that before was is before kids. Because the body changes after kids. No one's talking about this. Hormones in your body are going to be completely different before having kids than after having kids. The body's changing. Most women at this point will tell me that they have tried some kind of a fad diet, like a keto or intermittent fasting, or maybe they paid for an expensive weight loss program. They were able to lose like 10 or 15 pounds, but then it came back. Boom, came back. Next step, you go to the doctor, right? And the doctor runs a panel on you and they do a quick physical exam and they're like, no, actually you're good. Perfectly normal for your age. You know, maybe your cholesterol is getting a little high or blood sugar's starting to creep up there a little bit. You need to watch that. But, you know, if you need to eat a balanced diet and, eat less carbs and start working out and you should just lose weight just fine. The problem is that your hormones are out of whack, likely low. Your doctor did not check your hormones or probably didn't even know how to check your hormones, honestly. In traditional medicine, unfortunately, we just don't train our doctors how to look functionally at labs or especially at hormones. And so you're not getting evaluated by someone that's an expert in this area. I want to stop right there because that is so discouraging for people. Think about this for a second. You go to your doctor who's supposed to be the authority, who's supposed to know what's going on in your body, and they just tell you that you're normal, but you intuitively know that something is wrong inside, right? You know that something is different. Something was better before than it is now. Something has changed. And apparently there's no way to figure out what that is. And with that, I'm excited to jump into these hormones because that is the change. Those are the things that have declined. Those are the things that are no longer optimal in your body and are likely preventing you from feeling good and losing weight. Hormone number 1, let's talk about testosterone. So testosterone is something, especially in women, that is never checked. I've literally never seen another doctor check it one time in my entire career, 10 years. Which is pretty shocking considering that it's one of the 3 hormones produced by the ovaries. And what happens after 40 is that you're going to start approaching menopause at some point, 45, 46, 47. At some point in there, you're going to become perimenopausal. Those ovaries are going to start to shut down production. You're going to lose estrogen, progesterone, and guess what? You're going to lose your testosterone too. But what is testosterone responsible for? A lot of people think, oh, that's just a men's hormone. No, it's really important for women too. It's responsible for cellular regeneration. It's a hormone of anti-aging. It actually goes in, it gives you more energy. It helps your cells to clean out and reproduce. It helps you recover and repair. Believe it or not, it helps to reduce fat and increase muscle. It helps with sleep. It helps with motivation. It helps with libido. The list goes on and on and on and on. This is a hormone that's incredibly important in the body, and we're like, no, you don't really need it. Well, it's no wonder that women are struggling. On top of this, testosterone is incredibly anti-inflammatory in the tissues. So I want you to think about this for a second. If your body was making lots of testosterone in your 20s, maybe in your 30s, now all of a sudden it's not, your levels of inflammation are allowed to potentially go higher because you don't have as much of this hormone in your body. Step number 1 is you really need to get evaluated. The best way to do this is actually through saliva testing, functional medicine testing. It's not really covered through insurance. And so basically what you're going to do is you're going to spit into a little vial, send it into the lab. They're going to give you really great representation of where your testosterone is. So if you're going to have your doctor check this through blood work, You can get a representative test, but you really need to make sure you're checking total testosterone, free testosterone levels. That's basically unbound testosterone that's in the bloodstream, ready to be active and take action in a cell in any given second. Hormone number 2 is your thyroid. Guys, every single person, every single woman that I meet comes to me and they're like, something's wrong with my thyroid. I already know it. Something's wrong with my thyroid. Now, about 30% of the time, they're right. The other 70% of the time, it may be one of these other hormones we're talking about. But at 30% of the time is significant, so it has to be checked. But guess what? Your doctor is likely only checking a TSH, thyroid stimulating hormone. It's something that your pituitary gland in your brain produces to tell your thyroid to make more hormone. So what they're testing for when they run blood work is not actually active thyroid hormone or inactive thyroid hormone. If that TSH is off, they're going to prescribe medication based on that value, not on what you're actually producing. This to me is insane. So if you go to an endocrinologist, a good one, they won't do that. If you go to a functional medicine provider like myself, they won't do that either. What we do is we dig deeper in, we check a TSH, we check free T3, that's your active thyroid hormone, free T4, that's your inactive thyroid hormone, reverse T3. So these are all different forms of thyroid hormone where things can get stuck. And we want to make sure that at the end of the day, you have enough active T3, free T3, to stimulate your metabolism so you actually lose weight. In any weight loss plan, this is important because your metabolic rate is the rate at which you spend calories. And so we really want to maximize that. Be sure that your doctor is doing functional medicine testing on this so you are not just within the normal range, you are in the optimal range. The third hormone is actually 2 hormones. I like to combine into one because they're so important. I almost always talk about them together, estrogen and progesterone. Yes, these are 2 separate hormones. They are made in the ovaries in women. And with perimenopause coming into play in the women's 40s typically, what we see is this progression where estrogen and progesterone slowly stop being produced. You're not going to notice much at all. Maybe some increased irritability, maybe some changes in your periods, but more than likely, it's just going to be weight gain, typically. Unfortunately, it's fatigue, weight gain, maybe a little increase in inflammation in the body. You just start to notice that the body is changing a little bit. This is the best time to take action for estrogen and progesterone. Let's talk about the effects of both hormones very quickly. Progesterone, I see it as a mental health promoting hormone, something that gives you absolute confidence in yourself, takes away anxiety, takes away nervousness. It is something that impacts sleep significantly. So if you're somebody that wakes up all of a sudden at 2 o'clock in the morning, 3 o'clock in the morning, 4 o'clock in the morning, can't sleep throughout the night, racing brain, progesterone is usually responsible in this phase of your life, and you need to get that evaluated with your provider. On the other aspect, you have estrogens. Estrogen's also very important from an emotional aspect. It's also important from an anti-inflammatory aspect. It promotes skin health. It's healthy for the tissues, the vaginal tissues, the urinary tract tissues, brain health, heart health, blood vessel health, bone health. It prevents osteoporosis. I could go on and on and on. And it all has to do with this delicate balance between estrogen and progesterone. I bring them together because they have to be balanced. You can't have too much of one and not enough of the other. Most women I actually see have estrogen dominance, meaning they have far more estrogen than they need. Perhaps the body is inappropriately making estrogen, and it is not making enough progesterone. This usually just causes weight gain, fatigue, poor sleep, and overall just causes a lot of dissatisfaction for women day to day. Both of these hormones can be checked through blood work. I like to do that as a screening option, then dive deeper in with saliva or urine-based testing going forward, making sure that we're managing and optimizing things in a way that is the most detailed and getting the most information with the most accuracy. When it comes to weight loss and these 4 different hormones we discussed today, balance is critical. They can make or break your weight loss process if you do everything right. If you eat the perfect diet, if you exercise the perfect amount for your body, if you drink clean water, if you do all, you meditate 2 hours a day and your hormones are out of whack, then all of it still might be in vain. So 1, if you feel like this is going on with you, just get evaluated. Get yourself some lab work. Find yourself a doctor like myself, functional medicine specialist, who's going to dive deep, figure out the root cause of what's going on in your body, and then that actually has a system to solve the problem. So today we didn't talk about treatment at all. And what you want to do is it's going to be a little bit different for each and every person. We want to figure out what the root cause is behind the hormone suppression. There's a lot of things that we can do to support that process, whether it's herbs, supplements, functional nutrition, as well as bioidentical hormones. So these are all valid options, and we use them in conjunction with one another to give you the best plan possible to optimize your hormones, lose the weight, and get back to feeling like your old self again. All right, guys, drop a like if you enjoyed this video. Shoot a comment in there. It helps the algorithm, helps more people see this information and get empowered. And subscribe to the channel. If you want to see more information like this, then I'd be happy to have you. Go ahead and put that notification bell on so you can see when the new videos launch every week. Until then, take care.